Well, this city has some world-class cancer treatment centers, but until recently, there hasn't been a dedicated program to deal with the most common side effect of that treatment, fatigue. And we're not talking about just being tired. Cancer fatigue can be persistent. It can even be debilitating. Scott Adams is a kinesiologist and exercise physiologist who runs Cancer Fatigue Services. And Scott joins me now. Good morning to you, Scott.
Good morning. Thank you so much for making time for this conversation.
Absolutely. Let's talk about first, for some of our listeners that may not know, what exactly cancer fatigue is.
Yeah. Cancer-related fatigue is a deep feeling of exhaustion that doesn't match what people have done that day.
Hmm.
People can sleep all night and wake up feeling just as tired. By definition, rest doesn't fix it.
Hmm.
And for a lot of people, it's a thing that takes over their life, even after they finish cancer treatment. They can't work.
Hmm.
They can't show up for their families and friends in the ways that they want to. And there's this belief that people should just be, I don't know, like grateful they're
Mm.
alive. But when you're struggling to get through your days and those days turn into years, just being alive seems like a pretty low bar to set.
Hmm. And pointing it out as well, it's very, very different from the normal fatigue, as you're pointing out here, where if we get tired, if we get sick from the flu, or whatnot, recover and then eventually start getting your energy back. You've pointed out something really important. It is completely life changing. You may go in remission, you may be cancer free, but it does change someone's life completely if they're still suffering from this, and it is very much long term.
It absolutely can be. When we look at the timing of when it develops in people, there are some great studies that show that it can happen in and around the time of diagnosis,
Hmm.
certainly during treatment, but even in the months to years following treatment, people start to experience this new feeling of exhaustion, and it can totally derail their life.
Hmm. There is, when we talk about cancer, you need to kick cancer, you need to battle cancer, you need to fight it. That's narrative is around the whole rallying up to sort of give that person, the motivation and the support and whatnot. We're here behind you. But that can also work negatively as well. Talk to me a bit about that.
Yeah, so important and extends certainly well beyond the scope of cancer-related fatigue.
Hmm.
And this is actually something our advocacy and engagement lead, Peter Laneas, wrote about recently for a newsletter of ours. And I think the overarching point here is that labels or words like fighter, survivor, thriver, they're not neutral. They're inherently loaded labels.
Hmm.
Now, these words, they can be assigned by the person, but more often than not, they're assigned by individuals in the person's circle, which creates expectations that get put on the person.
Hmm.
And for some people, fighter may be exactly the right word.
Hmm.
For others, though, it may suggest that if people just fight hard enough, they'll win.
Hmm.
And that's not how cancer works.
Hmm.
Thriver's another one that puts a lot of pressure on people who are just struggling to get through their days and weeks. So I don't know, if you don't feel like you're thriving, you're somehow losing.
Hmm.
Um, I guess the point here is that if you're supporting someone with cancer, let them choose their own words.
Hmm.
It's a small thing that can make a big difference in how people see themselves and how they engage with the world around them.
And it affects people differently. Their recovery is different, both mentally and physically through all of this. I want to talk about the program that you've incorporated at the clinic, the research that's being done, connecting cancer with exercise, for example. Walk us through all of that, because that's sort of part and parcel of you really sort of directing the treatment towards dealing with this cancer fatigue.
Yeah, and I think the first thing to understand here is that cancer-related fatigue, given its complexity,
Hmm.
makes it a little bit more challenging to treat. Its causes are multifactorial. You have different overlapping reasons why people are fatigued. Certainly, the diseases or different cancers all can cause it. Then chemo, radio, surgery, hormone therapy, targeted therapies, they all leave their fingerprints on people.
Hmm.
Then you layer on emotional and cognitive challenges, cardiovascular injuries, muscle loss, sleep disturbances. It's pretty clear that we're not just dealing with one issue. For most people, and on average, I think we're sitting at around 5.5. Most people have around 5 to 6 causes stacked on top of each other.
Mm.
And that's what makes it such a challenge to treat. The clinic itself is offers OHIP-covered assessment, care, results delivery, care planning, and some therapies.
Mm-hmm.
And it's a physician-led clinic. So we bring people in, we examine all of the treatable causes of their fatigue, and then direct them to the right combination of therapies to actually address the underlying causes in each person sitting in front of us.
What kind of exercises are involved here?
Yeah, and that's the whole concept of exercise is a little counterintuitive for
Yeah,
most people. You mentioned earlier fatigue from things like the cold or the flu.
right.
When people are exhausted, their instinct is to rest. And for things like cold and the flu, that's totally the right instinct. With cancer-related fatigue, though, rest is actually the trap.
Mm.
The less you move, the more your physical, mental, and emotional well-being suffer, and the worse your fatigue gets. Exercise actually has the strongest evidence behind it as a treatment for cancer-related fatigue.
Mm-hmm.
But it's more than just going for walks or getting a gym membership. It needs to be prescribed, measured, and adjusted, just like a medication.
Mm-hmm.
And that's why we test each person's heart, lungs, muscles, coordinated cardiovascular function before we intervene,
Mm-hmm.
so we know exactly what their body can handle and how to precisely dose their treatments. For the majority of people coming through,
Mm-hmm.
it's a specific combination of aerobic exercise targeting very specific energy production thresholds in their body. But for others, strength training is equally as important. But again, it all comes down to the person in front of us.
Yeah, and I think, as you say, tailoring it individually to the needs of the patient is so critical and important. This is such a critical conversation, Scott, and the work that you and the team are doing out there to help cancer patients deal with everything that they're going through. I really appreciate it, you giving us your time today.
Thank you again for making time for the conversation.
Absolutely. This is Scott Adams, the kinesiologist and exercise physiologist at Cancer Fatigue Services.